inside and take a sip. Okay. Is that sugary? Can you feel the sugar taste immediately after dropping in a scoop of sugar inside and immediately sipping the water? No, because the taste of the sugar is not transferred to the water yet. The water has not taken the taste of the sugar yet. Right? So now you have to imagine the water glass as our own body with all the systems, and the sugar that goes inside is nothing but the food that we consume. Okay, the food that we consume. Fine. So, when the vehicle goes under reserve, what do? We go and fill with the fuel, and then it's tank full. We are also relaxed because it's tank full, and there's no stop. It keeps running any number of kilometers, like whatever is possible with that fuel. Our body has to act the same. 12:30 we feel hungry. Around 1:30 we have a great lunch, and by 2 o'clock our expectation is that we have to be at the peak of our energy, but unfortunately we feel little drowsy. Does that happen? It happens to everybody. Why should it happen? It wasn't reserved by 12:30, 1 o'clock, and the fuel has gone in terms of food. Fuel has gone in, and for the fuel that has gone in, it should act differently, right? It should be at the peak of its energy, but it is not so. Why? The food has gone in, but still the body has to get that digested. Not only digesting, it also has to absorb the nutrients and convert into energy, which will take minimum of 4 hours, it seems. And by then we take a cup of coffee and we feel very relaxed, highly energetic. Most of us, I have started my day from then till 3:34. I'll be lazy, like not knowing what to do. From 4 I'll start, and the peak of my energy levels with a great session till 8 o'clock. Okay, not even understanding that the people are hungry because I'm full of energy, right? So that way it is. No, that's not the right practice. The right practice is the body, once the food goes in, from 20 minutes on, it should start digesting and the energy starts sharing. It has to reach all the parts of the body, even to the small parts. So for that, the necessity of natural B is very high in our body. Now imagine the same water with a scoop of sugar inside, and you take a spoon and stir it. Okay. And now you sip the water. What is the feel there? You get the taste of the sugar. Fine. Now the spoon has mixed properly and has transferred the taste of the sugar to the water. Likewise, natural B goes inside the body, and it, you know, helps in the proper digestion and absorption of nutrients from the food and supplies to the entire part of the body. Now tell me, my dear friends, is it required for during pregnancy or not? It is very much required. So don't miss this opportunity of taking vitamin, B or natural B. It supports an immune system, normal brain function, and it's a great adaptogen. Like it relieves the stress and supports the mood enhancement. Okay. Talking about vitamin B6 and vitamin B12 and folic acid. Folic acid. This is one nutrient that any pregnant lady, or even before that, any girl who's attained her puberty stage could never miss off. And this is the first nutrient that anybody would require when she talks, when she even pronounces P in the pregnancy. Okay, so that very important nutrient, folic acid. And folic acid is nothing but a part of B vitamins. B vitamins, as I was telling you yesterday, they are 7 in number, 8 in number when it comes to family, but one is very independent, like biotin, and all rest of the 7 are, they take care of the other vitamins like B1, B2, B6, B12, niacin, biotin, leave away biotin, folic acid and pantothenic acid are closely knitted with each other. So that way, B6, B12, and folic acid plays a very, very, very big role in pregnant ladies' body. Vitamin B6 plays an important role in the development of the brain and the nervous system of the baby and prevents preterm birth. Fine. If somebody is with preterm birth, we could understand there could be deficiency of B vitamin in some stage of life. And ask her, she'll very clearly tell you, fourth month to sixth month, I didn't eat properly. Whose mistake? Is that the mistake of the child? Right? And B12 deficiency in the early pregnancy raises the risk of having the child with neural tube defect. Okay. Now you should understand what neural tube defect is and spina bifida is. Even before the lady knows that she is uh, going to, bear a child, she gets that feel because the periods misses and that anxiety sets in. 2 days, 5 days, she can be quiet and she'll check with the elders if she can get the test done. And slowly they'll say not immediately because their anxiety level is at the peak. So they'll say hold on for some time and after 60 days you can go for the check. And by the time she checks, get that check and knows that it is positive, two very important things would have already happened in the embryo or the fetus. What is that? The brain development and the spinal cord. It starts from there. For somebody, if you want to know from which part the baby is starting, from where it starts from the brain and it goes to the spine. Okay? And neural tube defect is, uh, you know, first let us talk about spina bifida, where the spinal cord, the spinal cord is, it should be straight, but it is bifida. It is like two. Okay, and it is not strong. You can understand that as of now, it is not strong. And neural tube defect is where the brain attaching the spine is not. There's no proper growth. Don't let us not get too deep into that. Where there will be some complication in the brain activity. Honestly speaking, many doctors, once they get to know that there is a defect of this, may not allow the kid to grow. They will say, this is not for you, please abort. But when the lady is becoming very sentimental, even they could not help it, they'll leave. They have to, no other go. And I know many lady doctors, Amway doctors who have come up. I have attended many of their seminars who very openly say this is a very critical problem where how difficult it would be to tell a mother that the baby is there, but then it is not going to be a very healthy baby for you. Where they very clearly know that there will be some or the other problem with the kid. If the problem is minimal, that's a chance taken. Whether the problem will be minimal or it's going to be big, nobody knows. The problem is minimal, good for both of them. The problem is not going to be small and the child is going to suffer for ages. And that too, if it is going to be a girl baby, imagine. Imagine during her adolescent stage. And all that is, my dear friends, why I'm talking about all this is just to insist upon the necessity of B vitamins at that stage. And can you believe it is just because of the folic acid and the B12 deficiency in the early stages of her life, of her, pregnancy stage, very early stage. Nobody can even believe. And she will very proudly say, no, right from the first day, my husband was taking care of me like that. Right from the first day, everybody were showing so much of love and affection on me. Gone because 4 weeks is already gone. By the time you know that you are pregnant, the brain is already developed and the spine is already there. Already there. Fine. So it is very, very critical. It is better, absolutely better. Think practically to have these supplements strengthen the body and get into family life. Fine. So that way folic acid is very important along with B12. So folic acid supplementation in the periconceptional period can prevent neural tube defect. Fine. Neural tube and spina bifida is something which is not in our hands, but very much in our hands. After pregnancy, it is not in our hands. But till the pregnancy level, it is absolutely in our hands. There's a high responsibility of us there. Please, my dear friends, take care of that. Okay? So, natural B with yeast is one supplement that has to be taken care of. And natural B has B1, B2, B6, B12, folic acid, everything in it. It is with yeast premix, which is enriched with B vitamins, and it has the additional benefit of inositol and folic acid. Inositol, we all know. Yesterday also we were talking about polycystic ovarian syndrome. So another possibility, another possibility where the pregnancy is getting delayed because of polycystic ovarian syndrome. There is a possibility where this can go and manage the situation to be quite positive to our side to a greater extent, my dear friends. So natural B is the moment pregnancy is planned, B vitamin should be there in the kidney along with protein powder. Right? Now, natural B with yeast helps supports in energy production. It provides two essential B vitamins, and natural B with yeast contains zinc that boosts our immune system. Out of these three, which is the correct statement? You can put it in the chat box. First one. Very nice. Thank you. Thank you. First one. Why not the second one? Because it is not only with two essential B vitamins, it is with n number of B vitamins, 7 B vitamins. Fine. And it does not have zinc. Zinc is not a part of natural B. Fine. We all know it is made up of yeast, and I was telling you yesterday that story. Yeast is deactivated yeast, which means it reaches the peak of activation and then it is deactivated so that the potency of the supplement stays the same till we consume. Okay, that's the benefit of natural B with yeast. Fine. Okay, coming on to iron. Iron deficiency anemia during pregnancy is absolutely difficult to manage. The levels of iron in the body, hemoglobin, at any given point in time during pregnancy should never be less than 13. 8, 9, 10, don't even think of pregnancy, my dear friends. Don't even think. Let the hemoglobin level at least come to 12 and then think of it. And at any given point, don't allow it to reduce from not even 1% from 13. Right? Minimum. Can go up to 14, not beyond that. Right? So, pregnancy outcome, 2 times the risk of preterm delivery if the iron deficiency is there, 3 times the risk of low birth weight baby if the iron deficiency is there. Right? And in infant health, what is the problem with the maternal health? It increases fatigue, intra and postpartum. Postpartum is after delivery, and during lactation, a lot of fatigue when the iron deficiency sets in, increased risk of infection, poor tolerance to heavy blood loss during delivery, and cardiovascular stress. Right? There's a lot of cardiovascular stress, unnecessary palpitation, unnecessary, anxiety, all that sets in, which is not great for heart. Infant health, lower iron status, 3 to 6 months postpartum. So, infant health is also highly affected because of iron deficiency during pregnancy. So, daily requirement of an average Indian woman during pregnancy is 30 mg of iron, basically, and during lactation is 25 mg of iron. And to support that, nothing great than cherry iron plus, nothing great than that. Because, like we saw yesterday, it is 15 mg of iron per tablet we get from ferrous bisglycinate, ferrous fumarate, and mustard greens. Both ferrous bisglycinate and ferrous fumarate forms are known for its absorption. And for iron, It is not how much of iron tonic we drink. It is how much of iron absorption goes to the body. Where in any supplementation as such, the absorption is not more than 60, maximum 60%, maximum. Fine. That is why most of the time iron comes with the tonic form, so that if the absorption is very poor, where the doctor can even recommend one more spoon extra, which is not possible with the tablet form. Right? Here we are very, very confident about our absorption rate. So it is 15 mg per iron. All that goes to the body with the support of vitamin C and folic acid, and with acerola cherry concentrate added to it, which adds as phytonutrients. So during pregnancy, 2 tablets at least is necessary for pregnant lady. Having said that, I would also advise any pregnant lady to get in touch with her gynecologist to understand if she can take this iron, because it is not the problem with the iron, it is the problem with the acceptance of the forms of iron in the body. So when the doctor says no to this, let us accept and understand, because they have some reason for that, and we have to abide by that. Okay. And if the doctor says yes, lucky you, continue till the lactation period is over. No stop there. Fine. And during pregnancy, deterioration of bone is quite common, because maximum calcium, the lactation is nothing but absorption of all the calcium from the body. So maximum calcium goes to the kid in the form of mother's milk. So bone mass metabolic change is something very, very common at that stage, whereby the mother feels severe body pain, and that too if it's a cesarean, nothing like that, severe body pain. So extra demand for calcium from growing fetus, especially the third trimester, physiological compensations through changes in, sorry, physiological compensation through changes in the hormone levels also. And intestinal absorption is high during that stage, which decreases the renal calcium loss, where a lot of calcium will not be thrown out of the body. It is absorbed by the body, and increase in the absorption from the maternal skeleton also. Body fetus needs calcium to grow, and as I told you, body has taken a blanket approval for calcium. Whatever amount of calcium it wants, it can go to any site of any body inside and absorb, just suck the calcium from there. So intestinal calcium absorption is the primary source, so it is better to keep giving, you know to the intestinal source is something from external, rather than allowing the body to take from one of the bones. It is better that we keep giving calcium to the body, so that it gets necessary calcium for the kid. Sources of calcium during that stage, this is just a chart that we have worked out, but just think if you can, take all this. And during pregnancy, I somehow could believe whatever you ask for they give, so it's still fine. After delivery, I can't even think of a mother giving ice cream to the delivered girl. Sweet potatoes, all that is restricted in the family. What is the source of calcium? How do we get calcium from? So the best source of calcium is to take, you know our calmac d plus. Calmac d plus, it is not only the calcium intake, it is also other dietary pattern that you have to follow. Drink 1 glass of milk, have 1 third of cup, take morning sunlight, must take green leafy vegetables on a daily basis, take 1 cup of ragi every day in any form, whatever form, ragi mudde or whatever you like. So that one form is always better. 1200 mg of calcium during pregnancy and lactation is something that is very much required. And how many tablets will be sufficient, because one tablet of calcium is 200 mg. How many tablets should we take for 1200 mg? Right? So that way, we cannot give everything through supplementation. So take necessary food that is rich in calcium, and take 2 tablets at the maximum, not more than that. Not more than that. It's a perfect combination of calcium, magnesium, vitamin D, zinc, and manganese, which can support very strong bones. As I was telling yesterday, This is one source, which is from red algae from the glacial waters of Norway. So the algae takes all the calcium, and the area itself is certified, which means the farming practices are just similar to what we do in Nutrilite. Meaning, Nutrilite only does this, but then in the sea, to practice the NutriServe Research organic farming practices is not that easy, but we have gone to that level to do that. That is why we could also succeed in getting not only calcium, magnesium, vitamin D, zinc, and manganese. They are the foundation for strong bones for the mother as well as for the kid. Right? So it is one supplement that has to be thought upon. And the biggest depression for any lady during pregnancy is, forget about pregnancy, particularly after delivery, is hair fall. Biggest challenge. And you know how it is attached with the tradition, because anybody knows there is a nutritional loss. The practical reason is nutritional loss. Because of the nutritional loss, the least important parts of the body don't get enough nutrition. Like hair doesn't get, nail doesn't get. So we have to give utmost care to those things. Otherwise, they will not get. All that goes to the baby. All that goes to the vital organs. That's the actual reason. But the family tradition says, as the child keeps smiling at you, the hair keeps falling. And we are also like one. We accept all that. Oh, my child is laughing at me. See, look at the smile. So let it smile, let my hair fall. And that is fine. But the confidence level, once we start moving around, once we start going back to work, what is the confidence level? So to maintain that, we have a fantastic supplement called Hair, Skin and Nail with Biotin Cherry Plus. The supplement is Biotin Cherry Plus, which can take care of hair, skin, and nail. Okay, it has biotin in it, and it takes care of brittleness in the nail, promotes healthy hair, and improves the skin condition. It has collagen, growth of hair, skin, and nails, L-cysteine, which is an amino acid, glycine, which works in conjunction with the collagen and promotes moisturization of the skin. This also supports in less marks, delivery marks. Okay, so that way it supports to a greater extent, and post delivery, the comeback is, the changes in the body is remarkable, because the dryness of the skin is absolutely common at that stage, and you can see skin is not very flaky, it's nice, smooth, and it definitely shows on the kid also. It's not only for you, it definitely shows on the kid also, because it goes through the milk, and the kid is also healthy that way. So it's a very natural way of taking. So amazing supplement there. This one shouldn't be missed during, maybe during the lactation period, if not during pregnancy, during the lactation period. Yes, nothing wrong in taking during pregnancy also, but then if you feel too many supplements are not necessary at that stage, yes, we should look at that also. We cannot be popping in tablets just like that. So it is better that we control certain supplements, restrict to what is said as the most important. See, why we talk about all this, because we have done a number of research on that, and if you know, we have consulted panel of Amway doctors who were a part of doing this module. I'm sure you will definitely appreciate these modules, because these modules nowadays, we know what sort of customers we are meeting, we know what sort of people we are addressing. So at least I personally have seen a huge difference in the content that we build these days. So the content today that we are talking is more practical and more knowledgeable, more informative, and we want you to replicate the same in the market to get more business. So that is the whole intention. And there are many ABO leaders, doctor leaders who have supported us in this particular module, and their inputs are taken there, and that is why you see a lot of information which has come from them is what that I have delivered it to you today here. Fine. So these are some of the supplements that we highly recommend for a pregnant and a lactating mother there. And again, I repeat, pregnancy is not only restrict to that stage, it is pre-pregnancy. meaning right from the day the kid is ready for wedding till the lactation period is over, and when the child goes to school, meaning the child takes external food and doesn't bother mother, and there's absolutely no link between the mother and the kid, where the nutritionally whatever she takes 100% goes to her. Till then it is her responsibility to take care of herself so that she can be a strong mother to take care of the kid. Right? So that's from my end. And thank you so much for being such a lovely audience. Till now, I could see a lot of people being there. And any specific questions, Mahin, so that I can address the questions? Will biotin help for psoriasis? To a certain extent, ma'am. If we fried fish till the omega 3 is present in it, doubtful.
What are the supplements safe for taking when lactating? Okay. Lactating and kids is year 1 year 3 months.
Supplement safe to take when lactating. Okay. Safe to take is all that we have spoken today. All that we
Um,
have spoken today, including biotin cherry plus.
can we take CFV during pregnancy?
Yes, nothing wrong in taking CFE during pregnancy. It is good. It is good.
How much? There's another question which says how much does we suggest compared to allopathy medicine, which contains more amount of ingredient like iron, calcium, etc.
Doctors are the right people to judge. That's why I said uh, leave that to your doctors. If the doctor says the same calcium can be taken even in 6, I'm perfectly okay with that. But Nutrilite says 2. 1200 mg in calcium supplementation of Nutrilite should be 6. But let the doctor tell that, not us. So,
There's another question, ma'am. Since we consume daily, how much of vitamin B supplement is suggested?
vitamin B, at least one is suggested. At least one. You can go for 2 also. After every heavy meal, it is better to take, but at least one is important. Deepa ma'am, you can suggest natural B protein powder and daily omega 3. These are the 4 that you can specific to Deepa Vijay.
Okay. There's another question, ma'am. I have been taking biotin for 3 months now, yet I have no control on hair fall.
Find if you have dandruff. Find if there's a lot of nutritional loss in the body. Check on the levels of calcium and iron in the body, ma'am. Iron deficiency or anemic also leads to hair fall. Too much of
Uh,
iron loss leads to hair fall.
so there's another question, ma'am. All the supplements necessary to take for lactating mother for a baby girl. How for how many months do a mother needs to take these supplements?
I think I have answered that. I have answered that. If you ask me, I would say till the child takes care of herself. There's no connection between the nutrition that the mother takes in any way doesn't go to the kid. So, which means till the lactation period is over. At least. My earlier statement was till the child goes to the school. Still, I stand with my statement. But then the minimum days is at least till the lactation period is over.
So there are a lot of on dosage questions, ma'am, on each product.
Yes.
So which ma'am has already mentioned is when she was doing every product. So if you have missed it out, not and worry. On the tablet box, till it's already mentioned how many tablets you can take.
It is the same. Don't increase or decrease because of this. If you want to increase, check with the doctor. We can't take risk in a pregnant lady. So it is better check with the doctor. They are the right people to tell. See, during pregnancy, our dependency on medication or doctors is very high. So let us not mess up on that. Supplements are supportive. Nutrient supplements are great. highly trustable. So nothing to worry about. But if you want to add a little to that in terms of numbers of tablets, doctors.
Ma'am, there's a question. What does mother with ADAH and depression take during pregnancy? Which all supplements with ADAH and depression during pregnancy a mother should take?
Uh, there's nothing wrong with the supplements that we have mentioned. There's nothing wrong to add ashwagandha to that. Add ashwagandha to that. That controls, anxiety and depression to a certain extent, and that will take care. Can ashwagandha be given? Yes, but also ensure that doesn't heat up your body. So have a glass of milk, cow's milk, after taking ashwagandha. This is only pertaining to pregnant ladies. Others, don't worry.
There's another question, ma'am. If people are suffering with constipation before and during pregnancy, can they take fiber and triphala?
Yes, yes. Constipation is a very complicated situation during pregnancy. Every time you constipate and put a lot of pressure to defecate, then it becomes difficult for the oxygen levels of the kid. So bowel movement is something that we must regulate. So make fiber or AVH as a practice.
There's a question by Jyoti. She asks, can we take a choose between natural B and daily during pre-pregnancy?
Yes, you can. And natural B is slightly better over daily during pregnancy because of inositol.
HR, your question, ma'am, has already clarified that you can take medicine with pregnancy supplements. Just consult with your doctors.
Iron and calcium can be taken together. See, there's 20 minutes difference. Yes, it can be taken. It both should not be kept at the same time and taken. That's the only problem. Otherwise, same time, 10-20 minutes difference. Yes, one after the other, you can take. But if you are so very particular about the absorption, better take it one in the afternoon, one in the morning. Nothing wrong. Okay? So
Yes.
thank you so much, Maheen. Thank you for that lovely questions that we had, and hope this session would have been of great support to everyone. And the third session, 17th is announced, but we will let you know on that. We will definitely let you know on that. And once it comes, this cycle is complete. We will complete the entire, cycle of womanhood. So let's celebrate womanhood, understand her concerns, and keep her healthy and happy, so that she takes the rest of the health of the family, rest of the family. Fine. Thank you so much.
Thank you, ma'am. Thank you for this wonderful training on Women's Health Day 2, which was on motherhood. You explained very well. As I told, for this session, you are the apt person who, because you have already gone through these stages. And I'm pretty sure when Shreya was there and you were already into Amway and you were consuming these supplements. So I could relate when you were talking a lot. Shreya is ma'am's daughter. So
Yes.
when she was in her motherhood stage itself, she was consuming and she did knew more. She knows a lot about these supplements, and you gave a lot of information. So I'm pretty sure all of you who are there in the session got a knowledge on what to be taken pre-pregnancy, post-pregnancy, and during the motherhood stage, what has to be done. So with this, we have been completing our day 2's training, that is on motherhood. Day 3, we will be continuing it later. So it's planned on 17th. The session details will be shared shortly. As ma'am said, if there's any changes, we'll let you know also. We are not yet fixed with the day 3, but day 3 is still there. So please keep in touch with me, with Sini. We will share out the messages with your upline so that you receive these messages. And at the day 3, we are going to learn on the menopause. So that's the third stage where there are 3 stages of women. All the 3 stages will be completed with our day 3 session. So thank you, ma'am, for taking us through this product ranges, and you always accept our training, which I am really happy, and I'm always like overwhelming when with sitting with you. It's just another feeling that we get by listening to you. Not only me, my whole house was listening. My mom, my bhabhi, they were also listening, and my bhabhi was like, "Oh, why didn't I listen to all these things? I just got pregnant, and where were you, Mahin?" So this was the conversation going on. I'm pretty sure in your houses also it's the same conversations which are going on, right? So not an issue. If there's another baby coming up, we have the plans. We know now what to be done. We are gonna help our family. We are gonna help our friends. We are gonna retail this to all our people, all those women who are going through motherhood stage. We can help them out. Okay, so with this, we have come to an end of our day two training. We will
Thank you.
see you again with our day three. Details will be shared to you soon. So
Thank
thank
you.
you, ma'am, and